And thanks to all four of you for your wonderful information, very informative presentations. We've gone over a little bit, but we still want to do a few questions if we may, please. Betha, I'd like to ask you a question if I may. You mentioned that you've noticed that people are losing their insurance, as we can well imagine with the jobs. How are you tracking that information, and to whom are you reporting it to help mediate that?
So what I mentioned was that we are seeing a higher number of patients who are telling us that their doctor's offices are closed. That is what we're seeing, who are saying they have nowhere else to go because their regular doctor is no longer there. We don't report that to anybody. We don't track it. Unfortunately, all tracking and reporting requires infrastructure and expenses that we just don't have right now. We do also believe that we will see an increase in patients who are losing their insurance, and that has been predicted widely from all of the medical, research associations. That's not just my prediction. But we haven't quite seen that yet. It usually will take a couple of months lag before patients losing their insurance and then enrolling in Medi-Cal or FPAC. Typically, when more people in the community lose their insurance, though, Planned Parenthood volume will go up dramatically because we take all comers, we take uninsured, and we write off all charges. So the main way that we'll know is through our increased enter, but reporting and tracking again is an infrastructure cost that we can't enter unless we and at some point if it's required of us.
Very good. Thank you, Betha. Helene, we had a question for you. Are the STD screening tests included in the ACA approved health plans?
Yeah, I believe so. I mean, that's part of preventive health, so that should be covered. An annual screening for gonorrhea and chlamydia in women under age 25 and syphilis testing as per recommended by the U.S. Preventive Services Task Force. So yeah, those should be free of charge. Right, Betha? Yeah.
That's right. Yeah, I responded to that person as well. Yes, that would be covered in the preventive health services, should be free of charge. Providers often, we find, though, are confused about the fact that you're not allowed to charge a copay or a coinsurance. So often women do find that they'll go and get those services and they do get charges, and it's difficult because it's an issue of consumer education and lobbying for their rights when it comes to the health insurance plans. But yes, you're right. It is covered under the preventive health.
So it would be covered if it's a well woman visit, but if someone has a symptomatic issue,
that's right,
then it's not going to be necessarily covered, right?
That's right, and that's where it's really tricky. Yeah. That's where it's really tricky with the copays and coinsurance. Yes.
Perfect. Thank you both. Michelle, thank you for expanding on the description and explanation of your credentials. Back in when I was younger, I remember being told to include the pharmacist as a part of my health team. And I took that to heart, and I did start doing that. And now that I am a caregiver for my mother, it's been very important to include the pharmacist to make sure that the medications, et cetera, are commingling appropriately. So thank you for what you do, because it's more important than some people know. Is it often are you often called to help to be on the health team?
Oh, yes, absolutely. So I'm clearly on the team at Radiant as an advanced practice pharmacist, and I also work with the Laguna Beach Community Clinic, but I work with all the HIV providers throughout Orange County and all the other agencies like Joyce mentioned, Shanti, trying to coordinate patients' medications and everything. I mean, I always view like an HIV patient or anybody, a Medicare patient, when they leave the pharmacy with that bag of drugs, it's like a loaded gun. And if you don't know what's in that bag and how to work with it and all the drug interactions and the absolute catastrophic ramifications that can occur, then there's no point. So with this work as an advanced practice pharmacist, I mean, the outcomes for so many of the patients have been quite extraordinary, being able to help them navigate through that, and the results show for themselves. So thank you for saying that. Thank you.
Of course, and thank you. Joyce, our last question obviously is for you. And what we'd like to know is, with the lessons being presented to many of our students over the internet, how are schools, or have you, Betha, this might go to you as well, how has distance learning been covering sexual or health education for our youth that's required? Have you heard of anything that's happening to meet?
I have not participated in any tele presentations in high schools, even though it is a required component. Because it hit in March, because we do it in the spring and the fall, so I was able to go to many of the high schools and get that education done before the schools closed for this semester.
Great. So you were able to do it just before.
In person, yes.
Betha, do you have anything to input?
Yeah, Planned Parenthood has a large health education department, and we did actively educate, do sex education in the high schools to help them comply with the California Healthy Youth Act, the CHIA. And ever since March, obviously no educators are allowed in the school, not even teachers are allowed in the school. And we are really in limbo. It's really been difficult. The teachers have barely been able to figure out, and the public schools right now, they're struggling with online teaching in general. And we really don't know. We haven't been told what the plans will be for reintegrating sex education back into the virtual environment. We are able to provide virtual sex education, but we're going to have to wait for the schools to tell us what their plans are, which I think they're struggling right now.
I think you're right. Ladies, thank you so much. And I hope our participants have enjoyed what you've had to share with them as much as all of us that are working on the team. I'm going to turn it back over to Allison and let her close it out. And again, thank you for staying with us a little bit over time.